And I think that knowledge is where clinicians have the biggest role in a payer. Whether they listen to us or not is a separate issue, but also it's also a role, I think, within the health tech space. Is just because you've seen one study. I had someone present a study to me from an incubator that was like, I want to build a kitchen that's going to teach people how to cook food better so that they could be healthier, because they read a study that people that eat whole foods versus processed foods are healthier. And I'm like, okay, so now yes, the study is correct, but we have no idea if actually is that even the barrier that we're dealing with. And this person, I don't think actually had funding at this time, but like, this is the type of ideas that get circulated, and some of them get surprisingly far. And they focus on patient touch, and like, yes, we'll make your patients more engaged with you, but they're making it more engaged with a vendor, not necessarily with a payer, and that's not the same thing. And I think a lot of vendors don't understand that it's not the same thing. And then also the enrollment rates tend to be so low, especially for all of these online solutions, that I really struggle with, are you getting to the patient that needs the help versus the patient who already knows how to work their smartphone and get this information out of them? And I very rarely see a vendor really address that portion of it. They're kind of like, well, we have a 30% uptake, which is better than the industry, which is true, because a lot of apps have an uptake of less than 10%. So yes, but like, that's not going to move my needle if you're only getting to a third of the patients.
So if I'm a part-time medical director with one of these digital health solutions, a lot of our folks will either be the friendly PC owner, or they're providing oversight to the clinical activity, or some of them are playing, medical director, fractional CMO type role. Like, what is it that like a good engagement looks like, right? So we've talked about ways that things can be poor, but what is it that they can do to add value to their clients to get something across the finish line with a risk-bearing entity?
I think they really, really need to focus on the patient experience in context of the full landscape for the patient. And I think that's where things tend to get lost. People think that I'm going to provide this product and this is going to be the single thing that the patient interacts with, and I'm focusing on my patient experience within this continuum, whether it's an app or a phone call or a service or whatever it is. But they're not thinking about how many other points of contact that patient has with their payer, with their pharmacy, with their PCP, and really educating the teams that are developing the products and trying to get those connections in place, get them in place with the data exchanges, right? The data exchanges are public. How do you interact with them? How are you going to interact with a PCP in a realistic manner? You're not going to send them a letter and expect them to react, right? Like, we know that that's not going to work.